Hello, Hoosiers. My name is DeMarcus Sneed, and I'm the Health and Human Sciences Educator for Purdue Extension in Madison County, Indiana. And today I want to give you some information about a topic that has probably impacted someone that you know. At the time of this video creation, there's a lot of attention being paid to the coronavirus, also known as COVID-19, because of the devastating amount of sickness and death that it's causing. And rightfully so. But there's actually another more quiet disease that's been causing even more sickness and death for Americans for years that's gone relatively under the radar. And that disease is heart disease. According to the CDC, heart disease is the #1 cause of death in the United States for both men and women, causing about 1 in every 4 deaths. In an average year, this equals to about 647,000 deaths. And while the term heart disease refers to many different types of heart conditions, the most common type is coronary artery disease. This particular type interferes with blood flow to the heart, which if not monitored, could lead to a heart attack. When we look at the anatomy of the heart is made up of 4 chambers that are divided into an upper left and right atrium and a lower left and right ventricle. These chambers circulate oxygenated and deoxygenated blood between the lungs and body to supply it with oxygen and nutrients that it needs to function. This blood is transported to and from the heart via arteries, veins, and smaller blood vessels called capillaries. Then there is a specific set of blood vessels on the surface of the heart called coronary arteries that supply the heart muscle with oxygen-rich blood. These blood vessels can become partially or fully blocked and hardened by plaque that builds up on the interior walls from cholesterol and other substances in the blood. This condition is called coronary artery disease or atherosclerosis, and it's the most common type of heart disease in the United States. But atherosclerosis doesn't just happen overnight. It starts when you're young and slowly develops over time, which is why older adults are at a higher risk of complications than young adults. But there are several other risk factors that play a part in a person's likelihood of developing heart disease. Some that a person can control, and some that they can't. As we just mentioned, age is obviously something that none of us have control over, but it does play a part in our heart disease risk. Gender, race or ethnicity, and family history round out the uncontrollable risk factors. When we look at the controllable risk factors, the list is much more extensive and includes high blood pressure, high cholesterol, overweight and obesity, poor diet, physical inactivity, excessive alcohol consumption, cigarette smoking, stress, diabetes, and inadequate sleep. As you can see, there's a lot more that we can control when it comes to our heart disease risk versus what we can't. The 3 key controllable risk factors for heart disease are high blood pressure, high cholesterol, and smoking. And unfortunately, 47% of Americans fall into one or more of those categories, which means that we have a lot of work to do. The next time you talk to a friend or family member, ask them one or more of the following questions to test their knowledge about the things that you learned about in this video. What is the #1 cause of death for men in the United States? What is the #1 cause of death for women? What is the most common type of heart disease? What are the uncontrollable risk factors for heart disease? What are the controllable risk factors for heart disease? These questions may spark some interesting conversations and surprising answers. For more information about heart disease and how you can reduce your risk, contact your local Purdue Extension office and ask about the Be Heart Smart program.